Well, you all know that recently many governments have imposed a ban on TikTok on work devices for security, but should parents be rethinking the access their kids have to the platform over physical and mental health concerns?
Debbie Opoku is a registered psychotherapist based in Barrie and joins us live this morning via Skype. Debbie, it's great to see you. So we know that TikTok has been around for a few years, but we also know that there's Facebook, there's Instagram, there's all kinds of social media platforms, and there is some data that shows it can have a negative impact on young people's mental health. Over in the States, they've imposed a wide ban in Utah, a bill already that says, hey, if you're under 18 years old, you cannot sign up for your own account. Very strict restrictions. Do you think that Canada is doing enough to protect young people from the dangers and harms of social media? Should we be doing something more in terms of legislation?
Absolutely. You know, TikTok's popularity is undeniable. Mental health concerns for users are really escalating. And as a clinician working with students, I have seen firsthand how TikTok's appeal can really turn to significant and potential harmful mental health problems. So when we talk about TikTok, when we talk about how fun it is and we do the dance and it's all creative and you learn new things, we also have to look at the harmful effects that it has. And I don't believe that we are really aware of how harmful TikTok is. And I think there needs to be more done in terms of understanding this, educating ourselves, and helping our youth.
So what do you see, Debbie, in your practice with your patients? What do you see in your clinic? Because, some of it, it just looks like people having fun.
Mm-hmm. Oh, absolutely. The first problem I would say is that when you watch a video, it'll suggest another video and another video. And you go down this rabbit hole of continuing to watch videos. And 3 hours have passed and you've sat on TikTok for 3 hours. So let's talk about screen addiction. Let's talk about the content that you're taking in. Now, there's been a huge impact on students' self-esteem, their body image, their confidence because of the negative comments that they may get when they post videos. So in instances, it can lead to depression, to anxiety, and even eating disorders such as anorexia and bulimia. And while these can be extreme cases, young users and even influencers on the platform have really expressed concerns over these negative comments that have really affected their daily lives. So when we talk about depression and anxiety, absolutely. When you see things, when you hear things, when you're viewing videos, they really glorify this content that can be really damaging to, a young child, a young person's mental health. Mm-hmm. So, and when you're not really educated in being able to take in that content, to understand what that means, it's very damaging.
Mm-hmm. So, Debbie, very quickly, I wish we had more time to chat, but what can parents do to, I don't know, whether it's limit the access or talk to their kids about what they're seeing on social media? We're not at that point yet where our government's forcing these companies to change their algorithms and the way they work, but what can we do at home starting today?
I'm going to really encourage parents to have this open and honest conversation with your youth. So let's talk about what's happening in digital space, right? Let's talk about what's happening with TikTok. Yes, it's fun. It's exciting. It's creative. It's funny. There's a lot of great content on there. But we need to understand what that content is and how damaging it is. So if you haven't, as a parent, sat down with your child and had this conversation about TikTok, about what's being shown, that's your first step. And if you're a parent, get your own TikTok so you can understand what's happening on this platform and really be able to take in what your kid is taking in, because it's so important that we understand as parents to help support our youth and what they're viewing in content.
Yeah, absolutely. That's a great suggestion there. Debbie Opoku, a registered psychotherapist, appreciate your time this morning. Thank you.
Thanks for the conversation.
Thank you both.